Welcome. I'm Dr. Taketa-Wong, and I'm glad to be with you for today's Facebook Live event. So today we're going to be talking about insomnia. There is new research on the value of sleep to human health, which shows just how important sleep really is. Now, for one thing, sleep is when the body clears out toxins. So poor sleep can leave us feeling tired out, anxious, irritable, accident prone, and more. An ongoing lack of sleep has been closely associated with high blood pressure, heart attacks, strokes, obesity, diabetes, depression, anxiety, memory loss, a weakened immune system, lower fertility rates, cancer, and psychiatric disorders. And it can even lead to permanent brain damage. So today we're going to talk about some of the causes of insomnia and what to do about it. As a naturopathic doctor and licensed acupuncturist, I regularly remind my patients that the notion that we are made up of parts like some robot is misguided. Remember that the body is a single organism. It's made up of all of these different pieces that are put together, and they all work as one cohesive whole. So it's really important to look at all of these different aspects when we're looking at how we can help you to be able to get to the underlying cause of sleep difficulties and how we can help you to be able to heal long-term, permanently. Consistent, good quality sleep helps the whole body to do its job well. And when we don't get that, then our daily lives become very, very difficult. And so what we really need to do is look at it as a whole body approach. Now, this is important because every aspect of our body is connected. Getting the nutrients that we need is also the foundation of a healthy life. And did you know that insomnia in some cases may actually be linked to nutrient deficiencies? However, in the United States, fewer than 20% of conventional medical schools require any courses in nutrition. Of those 20%, the typical offerings total fewer than 25 hours. That's 25 hours in 4 years, at a time when most of our chronic diseases are food-related. Naturopathic doctors like myself typically receive 155 hours of nutrition. We are trained to educate and guide patients to build their physical and emotional health from the inside. So while I attended a 4-year medical school, just like MDs, and order lab tests, write prescriptions and such, I approach treatment comprehensively, including all aspects of a person's health, which is why my patient visits are 1 hour, not 10 or 15 minutes. It is a partnership for health between me and my patients. If you have a health condition you would like to talk with me about, please contact the office and schedule a free phone consultation. There's no charge because I don't take new patients without reviewing their situation first and coming up with a plan to help you get better. All of the contact information is on our Facebook page. Now, to our topic for today, insomnia. Insomnia is the name of a sleep disorder where people can have trouble falling asleep, difficulty staying asleep, or often wake up too early and are unable to fall back to sleep. At one time or another, half of the American population deals with insomnia for a time. And for some, the condition resolves without doing anything. However, for all the rest, insomnia can make life miserable. In fact, according to the CDC, chronic insomnia that does not go away affects 33% of the adult population. That's 1/3 of the people living in the United States. Insomnia can be rooted in many different causes, so it's vitally important to understand what's going on if one wants to enjoy consistent, good quality sleep. Some of the more common reasons include a poor sleep environment, such as a room that's not dark enough or sufficiently cool. There may be uncomfortable bedding, loud noises such as the neighbors blasting their TVs or music, or those early morning trash trucks. Now, these external factors lend themselves to common sense answers. And that's not easy to say that they are easy to implement, but it's pretty clear what needs to be done in cases like that. Other contributing factors to insomnia may include things like work or family stress, frequent long-distance travel, a work schedule that disrupts one's circadian rhythm, and financial difficulties. Aging causes many changes in the body that can result in disrupted sleep patterns. When it comes to stress, I often will recommend Qigong exercises, which can resemble Tai Chi, but they tend to be easier to learn. Meditation really does make a difference, and there are many excellent videos on YouTube. People can pretty quickly find an approach that works for them. Many religious organizations offer counseling to their members, and that can often lead to discovering things that can help people to find ways to reduce their work or family stress. There are also non-religious organizations, many psychologists that provide counseling, often which is mostly covered by insurance. Now, it's important to remember that food and beverages definitely play an important role when it comes to consistently getting good quality sleep. It's important to avoid beverages with caffeine after 4 p.m. Nicotine is a stimulant, and that can interfere with the body's sleep mechanisms. The same is true for alcohol. Sugary foods can cause energy levels to spike and are best avoided altogether anyway for better health. One thing that's important to remember with sugary foods is that your blood sugar can spike, and so that can make it difficult for you to be able to fall asleep. But then oftentimes within an hour or two, the blood sugar levels will crash. And if your blood sugar is abnormally low, that could actually cause you to wake up during the middle of the night because your body says, hey, our blood sugar is low, you need to eat something. And so eating within 2 hours of bedtime, particularly sugary foods, can often lead to sleep patterns being disturbed. What's important to keep in mind while we're discussing insomnia is that my patients and I are in a partnership for health. My protocols and guidance added to their commitment to improving their own life or their child's enables them to be empowered when it comes to their health. That means they learn how to heal their condition or their child's condition and bring about more health and happiness for the entire family. Also, if you're looking to purchase supplements, they need to be ones that are tested for quality by independent laboratories. So please check out our online supplement store. It is the only one where all the products meet the highest standards for quality and where proceeds go to supporting treatment for children with special needs. In addition, you'll also receive 20% off the regular prices. That's at drtaketa-wong.com. That's drtaketa-wong.com. And you'll find the link in the post with this video. Chronic pain can also cause difficulty with sleep, both in falling and staying asleep. While most people just use over-the-counter pain medications, which often do little to help, there are some good natural alternatives. I have found that acupuncture can be effective for many types of chronic pain, as well as other causes of insomnia. Also, I've seen a number of patients report that CBD oil used topically or orally has helped them. I've seen good results with turmeric in certain types of chronic pain, such as arthritis, some headaches, and other conditions related to inflammation. There also are some natural pain relievers that are not hard on the liver, like is the case for many over-the-counter pain medications like ibuprofen or Tylenol. Another cause of sleep difficulties can actually be medications themselves. So medications can disrupt normal sleep. So can mental health conditions such as anxiety and depression. Medical conditions affecting sleep can include chronic pain, as I mentioned earlier, but also things like cancer, diabetes, thyroid or adrenal problems, sleep apnea, and being overweight. I want to delve a little bit more into thyroid and adrenal problems because these are ones that often are really not talked about very much in conventional medicine and often not on the radar for many conventional medical doctors. Adrenal dysfunction is often a contributor to sleep problems because the adrenal gland makes cortisol. Cortisol is very important in terms of regulating our sleep and wake cycle. Cortisol is also important because it helps to decrease inflammation, and it's important for energy and is also involved in regulating blood sugar. Now, we want our cortisol levels to be normal, not too high or too low. And I've seen many patients where they have either cortisol levels that are much too high and cortisol levels that are too low. Now, what is supposed to happen is that in the morning, your cortisol levels are supposed to start out high. And what happens is that as you go through the day, this cortisol levels gradually go down. So your cortisol levels are supposed to start out high in the morning time so that you wake up, you have the energy that you need to get going for the day. And then as the cortisol goes lower and lower, by the end of the day, the cortisol is supposed to be low so that you are then ready to go to sleep, to be relaxed and calm and to be able to fall asleep. However, what can happen is that some people may have an abnormally low cortisol level in the morning, and so they're waking up groggy and tired and just exhausted, and they have no energy to get going for the day. And then as the day goes on, their cortisol levels actually go up. And so by the end of the day, when your cortisol level is supposed to be low, their cortisol levels are sky high and they can't fall asleep. They can't settle down. Their mind is racing. They're just going, and it's like you just can't fall asleep. And so those are people who then have trouble sleeping at night. And if there's abnormal cortisol levels throughout the night, that can also interfere with your sleep. So fortunately, there are natural medicine approaches to remedying the situation. If the adrenal function is too high or too low, I often prescribe specific amino acids and herbs that are very effective in helping to bring the adrenal glands back into balance. Now, some people with insomnia take all kinds of things to try to help, when the issue may actually be their thyroid gland. That is because the thyroid regulates the body's metabolism, such as calories that are burned, heart rate, energy, and many other functions in the body. Sleep troubles can be caused by both an overactive thyroid gland and an underactive thyroid gland. I will say that very often conventional medicine does not conduct thorough testing for thyroid problems. I've seen well over 100 patients where they had maybe one or two tests done for their thyroid, and those were normal. So they were told, okay, your thyroid's fine, no problems with your thyroid. But they had all of the thyroid symptoms. And then they came to me, I ordered additional lab testing, and we found that those tests actually came back abnormal, and they actually did have a thyroid issue. Natural medicine has many approaches to helping to bring the thyroid back into balance, including nutrients like selenium and tyrosine, as well as different herbal regimens, depending on whether the thyroid is over or underactive. And this is an example of nutrient deficiencies. For example, if you're deficient in things like selenium or tyrosine or iodine, that can cause problems with your thyroid, which can then cause problems with your sleep. And there are also other kinds of nutrient deficiencies that could contribute to sleep problems as well. So doing a thorough testing regimen for that is very important. With other medical conditions like cancer, diabetes, being overweight, for sleep apnea, there are many naturopathic remedies that are very effective, including upgrades to one's food and beverages, acupuncture, and specific high-quality supplements and herbs. I also want to mention another therapy that I found to be very, very helpful for insomnia, and that is a type of neurofeedback. So we do a type of neurofeedback called neuroptimal neurofeedback. And what it is giving feedback to your brain to help your brainwave patterns move into a more balanced brainwave pattern. We have different types of brainwaves, including alpha, theta, delta, and gamma brainwaves. And there are certain types of brainwaves that are supposed to be more prevalent when we're having a deep, restful sleep. There are other types of brainwave patterns that happen when we are feeling really anxious, when we're stressed, or when we need to be awake and really focused on things. Now, if you have imbalances in those brainwave patterns, that can lead to significant difficulty with sleep. So neuroptimal neurofeedback, what it does is it helps to naturally give feedback to your brain. I explained that it's like allowing your brain to look in the mirror and to see its own brainwave patterns. And then when your brain can see its own brainwave patterns, it will try to correct it and move it towards a more balanced brainwave pattern. And this is something that you can essentially train your brain to do so that it can stay in a balanced brainwave pattern. So neuroptimal is not a therapy that you need to continue for the rest of your life. It is intended to train your brain to get and stay in a more balanced brainwave pattern so that you can have long-lasting help and relief from insomnia by naturally training your brain to be more balanced. I trust that our discussion about insomnia has been useful for you. Does your doctor take the time to educate you like we're doing here today? If not, you're welcome to talk with me personally about any health concerns that you may have so that you too can feel empowered with your health. To do so, just call or text our office to schedule a free phone consultation with me. There's no charge because I don't take patients without talking to them first. I always want to make sure that what I do fits their needs. And you'll find all the contact information on our Facebook page. We can talk with you about your health concerns as well as talk about neuroptimal and how that could be helpful for your particular situation. Thank you again for joining us. I look forward to seeing you again in 2 weeks. Aloha.